Okay, colleagues, let me start with one very strong message to all of us. I just quote Article 4 of the Treaty on the Functioning of the European Union. Article 4, the Union shall share competence with the member states where the treaties confer on it a competence which does not relate to the area referred to in Article 3 or 5. And shared competence between the Union and the member states applies in the following principal areas. A lot of areas, and area point K. Common safety concerns in public health matters for the aspect defined in this treaty. Common safety concerns. And when we are speaking about vaccination, we are thinking now in front of us COVID pandemic, influenza pandemic, measles outbreaks, a lot of outbreaks. It is common safety concerns, yes or not? It means that it is common for the European Union and for member states. This based on shared competences. And it allows us to move quickly when COVID strikes over us. Commission used this article creating some joint procurement agreements, organizing vaccination campaigns and so on and so on. It helps. And now when we're speaking about life course immunization, we are speaking about the same issue, because we all know that without prevention, protection, and promotion, and participation, we have no chance to address common safety concerns. We have no chance to solve problems with our future crisis. Preparedness. Once more, preparedness requires effective tools at national, local, national, and EU level, because it is shared competences. And why I'm arguing about? Because, when I speak of life course immunization, always we can to understand that we need to encourage member states to cooperate, keeping in mind that it's shared competence, not only national competence. And of course, I have in my hand such book, European Health Union, a blueprint for generations. And here is big article about vaccination and our possibilities to encourage member states to think much broader, to avoid such mentality when we were without Schengen requirements. Now free movement of people means free movement of diseases, free movement of all viruses, and free movement of all of us. And of course, only one way. How can we harmonize our efforts? How can we encourage member states to deliver their promises, because it is shared competence? And vaccination campaigns and vaccination assets and vaccination tools need to be understood as a common safety concern. And of course, I can show you also one very important document. It was built with the Mission Board on Vaccination in Europe. Of course, I was one of them here in this, and I see my friends around. It is, of course, also about life course immunization. Because we need to understand that when we are speaking about such, we are not speaking just about narrow approach. We need to think about very broad approach, and of course we need to understand that we can address life course immunization issues, recognizing the broad benefits of vaccination for people at all stages of life, children, adolescents, adults. Second, intersectorial collaboration, working with those outside the health sector to strengthen immunization policies, their implementation, education sector, employment, social policies. Then strengthen and sustainable financing of immunization systems. It is crucial to recognize that immunization is a highly cost-effective public health intervention that represents a strategic investment in population health and health systems resilience with substantial economic and societal benefits. It's also shared competence. And immunization system perform monitoring and assessment to examine the performance of vaccination programs against key criteria, goals to enable and facilitate cross-country learning, and to identify potential issues of concern and opportunities for improvement. And our efforts to establish such interest group based on those legal grounds and the possibilities to unite all of us here in this house and also around all member states, asking you to be very active partners of such initiatives. Thank you so much.